Hi, everybody. We want to thank you for joining us today. Before we get started, Loren, is my screen and everything we're looking good on your end?
Yes, it looks good.
Okay, perfect. Well, we appreciate everybody joining us. I know this is the last session of the second day of the conference, so we appreciate you hanging in there with us. Okay. All right. I think it looks like we're getting everybody in. All right. Thank you, everybody, for joining us today. My name is Susan Gamble, and I'm the director of the West Virginia Statewide Afterschool Network. And Loren, do you want to introduce yourself?
Sure. I'm Loren Farmer, and I am a program coordinator with the West Virginia Statewide Afterschool Network, and I've been with the network since about April.
Thank you. For any of you that aren't familiar with the Afterschool Network, you've probably kind of gathered about some of our efforts through this conference, but we really work to help promote and sustain and share about the importance of high quality after-school efforts across West Virginia. So we have the fortunate opportunity to work with 21st CCLC programs and childcare centers, in-home providers, YMCAs, Boys and Girls Clubs, you name it. We get to work with all those different groups, really advocating and talking about the importance of high quality after-school programming. And one of the recent efforts that we have been working on is a new initiative called the Afterschool Heals West Virginia toolkit. And we're really excited to share that with you today and sort of dive into some of this work. You guys are actually the first official group that we are talking about this with beyond our planning team here in West Virginia. And so we're just really excited to share where we're at with this project today. Let's just talk through just a bit of, there we go. A bit about what we're going to do. We're going to have a welcome. We're going to talk about the general overview of our opioid crisis, which I know, we're probably all very familiar with. The role of after school is prevention, and then next steps with our project and kind of what is going on with that. So as I said, Loren and I are going to be our two hosts with you today. And since it's just the two of us, we don't have a room host. It's just me and Loren. We're pretty casual and informal here. So, but we're excited to be with you guys today and talk about this new project. This effort has been something that's been in the making for a bit. So this is actually a replication project that we are partnering after an effort that Tennessee did. So Tennessee Afterschool Network, along with the United Ways of Tennessee, was able to build two toolkits, one for after school and one for United Ways to use with employers, with businesses. And so Tennessee reached out to us about the possibility of a replication project, and we jumped on it and said, absolutely, this is something that's a needed resource in our state, and we would love to offer this. So we were actually able to get just a small grant from them and have been working through this process to put this together. So here in West Virginia, we have been partnering with the West Virginia Rural Health Association, as well as the United Ways of Central West Virginia, who will also be sharing this information with other United Ways in our state. And again, are putting together, helped us design and put together the toolkit, which we're going to talk a lot about today. So this isn't necessarily a new information. We know there's a lot of resources out there in West Virginia and a lot of information to combat our severe opioid crisis of our state, but it's really thinking about having everything in one place and some different angles of how we're sharing that information, which Loren and I are going to talk about. And then that opportunity to compile in a way that's handy and accessible and useful for after school programs. So again, just thank you everybody for joining us today.
Okay, so before we jump into the actual project, I just wanted to go over some contributors contributors to the opioid epidemic and sort of frame the need for this project. Next slide, please. So how did prescription painkillers become a problem? So the cause of the opioid epidemic has largely been contributed to pharmaceutical companies. And while these companies have contributed significantly to the rise in the opioid use, the causes of the epidemic are myriad and complex. A general overview of contributors to the epidemic begins in the latter part of the 20th century, when worldwide attention was brought to the undertreatment of pain, specifically post-operative pain and cancer-related pain. In 1995, the American Pain Society launched a campaign to introduce pain as the fifth vital sign, which was supported by the Veterans Health Administration's adoption of pain as the fifth vital sign in 1999. In addition, during the same time period, Purdue Pharma received approval in 1995 for OxyContin, which the company erroneously claimed was less addictive than other opioid pain relievers. Also, the Joint Commission published standards for pain management in 2000, which emphasized the need for quantitative assessment of pain as recommended by the Institute of Medicine. So the rapid institution of strict standards for pain management in hospitals resulted in increased reliance on opioid medication, and many hospital administrators were really worried that they wouldn't receive federal healthcare funds if they didn't meet the Joint Commission's pain management standards. As a result, prescriptions for opioids tripled between 2001 and 2011, partly due to doctors overprescribing the drugs. Opioids flooded the market, opening up increased opportunity for substance misuse. Eventually, the federal government did increase regulations on prescriptions for opioids, which also resulted in individuals who couldn't access those drugs turning to other alternatives such as heroin. So as we know, opioids are highly addictive, and addiction is a complex disease that can't be overcome through willpower alone. Addiction, it's a clinical disorder, and it has biological, psychological, and sociocultural contributors. Research has shown that repeated drug use leads to changes in the structure of the brain that make the body crave more, stronger doses. So that's a little bit about how opioid drugs became a problem. So the next slide. So this diagram contains information from the 2018 National Survey of Drug Use and Health, and shows that the source of where pain relievers were obtained for the most recent use among people aged 12 and older. And the survey reports that 11.1 million people aged 12 or older misused prescription pain relievers in the year prior to the survey. And the survey again was in 2018. So as you can see from this, this chart, the main source of prescription pain relievers were obtained for misuse were from a friend or relative, with 38.5 obtained from a friend or relative for free. And then the second largest source of prescription pain relievers obtained for misuse was through a prescription stolen from a healthcare provider, through a prescription or stolen through a healthcare provider, with 36.1 obtained through a prescription from one or more doctors. So most pain relievers were really obtained for misuse were through a prescription or through a friend or family member. They weren't stolen. They were given willingly either by the friend or family member. And so although increased regulations have worked to curtail some overprescribing, it appears that there's still an oversupply of prescription pain relievers, especially if people are getting them from friends or family members who are given to them, willingly and for free. Next slide. So the consequences of drug misuse have been devastating, especially in West Virginia. In 2017, the age-adjusted drug overdose rate was 21.7 per 100,000 for the United States. In West Virginia, the age-adjusted drug overdose death rate was statistically higher than the US, with the highest rate among all 50 states and DC at 57.8 per 100,000. So we are one of the states most hardly hit by, drug misuse in this epidemic. Next slide, please. As we can see in this chart, overdose deaths increased exponentially in West Virginia between 1999 and 2018. So the light blue bars represent all opioids, while the darker blue line represents prescription opioids, the yellow line represents synthetic opioids, and the orange line represents heroin. The DUG categories presented are not mutually exclusive, and deaths may have involved more than one substance. Opioid-related overdose deaths usually occur as a result of mixing opioids with other substances such as alcohol or benzodiazepines. Additionally, synthetic opioids such as heroin can be adulterated with fentanyl, which lethal dose looks like a few grains of table salt. So if we look at the data, we also see a decrease in the prescription opioid-related deaths beginning in 2011, which correlates with the increased regulations around prescription opioids. And at the same time, you see an increase in the synthetic opioids and heroin-related deaths. And again, those synthetic opioids, specifically heroin, can be laced with other stronger drugs. So these substances filled the gap in a market once prescription opioids were less readily available. So this data is really tragic. However, the situation has only been made worse by COVID-19 pandemic. An article published by the Mountain State Spotlight in 2021 reported that drug overdose deaths totaled 1,275 in 2020 and 45% increase from 878 deaths in 2019, and the highest number of any year on record. Many of you could probably name a life loss that is accounted for in these numbers, whether it be a friend, a family member, or someone connected with your after-school program. The opioid epidemic has touched all of us, including your children, in one way or another. Next slide, please. The statistics on this slide highlight some of the ways in which the opioid epidemic has impacted children in West Virginia, as well as the United States. And keep in mind, again, that these statistics are from 2017 and don't include data from the height of the epidemic to date. So in 2017, 45 out of every 1,000 children in West Virginia were affected by opioid use, whether it was by a parent or their own use. That's over 5% of the population under age 18, or 1 in 20 children. So according to these statistics, if you have an after-school program that serves 40 students, you likely have at least 2 children in your program affected by opioid use. However, the rate for many of you is probably much higher because you serve more at-risk populations. As we know, the impact of the opioid epidemic goes much further than a statistic and has social, emotional, educational, physical, and economic consequences for children and their families. For many families, this has resulted in removal of children from the home. This has caused an additional burden on an already taxed child. Sorry, my dogs are barking at the door. Already taxed foster care system. Currently, there are around 7,000 West Virginia children in state custody. This is the highest per capita for all 50 states, and the number is growing. The education and child care systems have also felt the effects as they work to serve children and families dealing with toxic stress and trauma related to substance misuse. This paints a pretty bleak picture, but I want to emphasize that there is hope, and that after school and summer learning programs are uniquely positioned to not only support children and families in crisis, but also to help prevent future misuse among children and youth, putting them on a path to a healthy future.
All right, so Loren shared some very valuable statistics and information there with us. And again, we know a lot of that is a lot of what we hear every day in our news here in West Virginia. As Loren said, we've all been impacted by the opioid crisis in our state in one way or another, whether it's a friend, a family member, and certainly we, witness the impacts within our after-school programs. Many of the children within the programs that we serve have also been impacted. I know, some of the conversations that I've had with providers as they have been serving youth impacted by this crisis. It's just heartbreaking. So that is, again, really how some of the work came about with this effort with West Virginia getting involved with the toolkit that we put together, because we know that after school can be an important factor and play a valuable role in the prevention portion of what is happening with our children. And so we know that after school provides healthy relationships, safe environments, character development, prevention education, and then also links between communities and resources and families. And, you know, there's also that role that we play within prevention, but also, and Loren is going to talk some more about this too, but, you know, the role around trauma and ACEs and other ways also that after school supports youth. We've heard during the pandemic, our state leader at the Department of Education talk a whole lot about every student having a caring adult. And that's just so important in our after school programs, as we know that our after school providers play a very valuable role in our caring adults for the youth that they are serving. So does after school really make a difference? Yes. Studies show that youth who are not involved in constructive supervised extracurricular activities are more likely to engage in risky behaviors. You know, we used to talk about those hours, especially of 3 to 6 p.m., but now we talk more about 2 to 6 p.m. We know that through a variety of reports that come out, and then also a report that the After School Alliance worked with Fight Crime on a couple years ago, talking about that 2 to 6 p.m. is when kids are most likely to engage in risky behaviors, and then engage in behaviors that can lead to engagements with drug use and delinquency and all those things, but also, you know, possibly also a time of thinking around whenever they might be more likely to, you know, have those not have those opportunities, but engage in those things that can lead them, you know, down a path where we don't want kids to go. And after school has such an important role within that place. So next, I'm going to hand it back over to Loren. Loren, I just almost kept talking there. Sorry, to share some more about the project.
Okay, thanks. So as we mentioned before, the West Virginia, or the Heals West Virginia project, is a replication project through the United Ways of Tennessee and the Tennessee Afterschool Network. And in West Virginia, the United Way of Central West Virginia Rural Health Association, and the West Virginia Statewide Afterschool Network have partnered to drive the efforts in our state. Next slide. What we are replicating, as Susan said, are two toolkits. One is the Afterschool Heals Tennessee toolkit, which is geared towards after-school providers, and the second is the United We Heal Tennessee toolkit, which is geared towards employers. So the Tennessee has websites dedicated to each toolkit in addition to the actual toolkit documents. If you wanted to check them out, you could find them at the web addresses listed on the slide, and I'll also put the links in the chat box here in a minute for those of you who might want to go and check those toolkits out. In West Virginia, we're not going to have websites for the toolkits, but we will provide access to them through most likely the United Way of Central West Virginia website. And in this session, we are focusing specifically on the Afterschool Heals West Virginia toolkit. So give me a second and I'll post these links in the chat.
And while Loren's doing that, I'll go ahead and say thank you so much for sharing those, Loren, that I think too that some of what you see that comes out of ours is going to look, you know, similar to the Tennessee pieces. But even though it's Tennessee, if you want to go ahead and take a look at those now, they have some great resources. Some of them are Tennessee specific, but a lot of them can be utilized no matter where you're at. So it's a great resource for programs in West Virginia also.
Yeah, for sure. Okay, can you hop over to the next slide? Oh, here we are. Never mind, you already got there. Okay,
sorry,
so
I think there's a little delay after I do it. Sorry on your
well, and my internet isn't stable today, so
no.
my end too. Anyway, so the Afterschool Heals West Virginia project is driven by the problem statement. There are many resources in West Virginia to address opioid misuse and substance use disorder, but few meant for out-of-school time professionals. So our goal is really to create a go-to document that after-school professionals can use to help staff understand substance misuse and the effects that substance misuse has on children and families, as well as provide ideas for ways programs can respond to the opioid epidemic and support children and families affected by substance misuse. And just to be clear, we're not creating any new resources or programs, but simply collecting information about already existing resources and organizations who are working in this area. We're wanting to amplify the voices of those who have already doing the work and provide after-school programs with an easy access point for joining in that work. Next slide, please.
I think that, no, I was going to say, I think that that's so important because sometimes you might think, well, you know, we have all these resources, but even as we were meeting with our leadership team that was helping to provide input and guidance, you know, it was clear that, you know, there were resources out there we weren't aware of, and other people were saying the same thing. And so we just really hope this will be a valuable tool for programs to have this put together in a friendly format that's more assembled for out of school time professionals.
So in order to develop the West Virginia Toolkit, Tennessee provided us with an initial list of resources used to develop their toolkit and added West Virginia resources to make it relevant to our state. So the key West Virginia partners, which included, as I mentioned before, the United Way of Central West Virginia, the West Virginia Rural Health Association, and the West Virginia Statewide Afterschool Network, convened a task force of stakeholders who work in this area to review the listed resources and make suggestions regarding additional resources that might not have been included, like Susan said. So the task force was comprised of a wide variety of organizations and disciplines, including but not limited to the West Virginia Department of Health and Human Resources, Bureau for Children and Families, and the Bureau for Behavioral Health, the West Virginia Department of Education Office of Student Support and Wellbeing, and Think Kids. And like I said, there are a number of other organizations that as well, including some programs that gave input. So based on that feedback, the resource list was updated and provided to the United Ways of Tennessee, who has worked to put the information into a format that's more visually appealing into the toolkit. The toolkit is still in the drafting process, but you can see here a screenshot of the cover page on the slide. The Afterschool Heals West Virginia Toolkit, as well as the United We Heal West Virginia, or West Virginia Heals, United We Heal West Virginia Toolkit will be published in conjunction with a joint meeting with the Tennessee Afterschool Network and the United Ways of Tennessee on November the 8th. Where the updated Tennessee toolkits will also be revealed. So we would like to invite all of you to join us for this meeting as we reveal the toolkits, and information for registering for the meeting will be provided later. I'll put it in the chat a little bit later in this session, but we would really love for you guys to join us as we reveal the toolkits. We're planning on doing some breakout groups. There'll be breakout groups for 2 breakout groups for Tennessee and 2 for West Virginia. And the breakout groups, one will be for the Afterschool Heals and one will be for the United We Heal. Okay, next slide. Okay, so the Afterschool Heals West Virginia Toolkit will include a variety of resources, including those that are West Virginia specific, national and after-school specific, and we'll cover topics such as substance misuse, substance use, addiction, prevention, trauma, and mental health, woven throughout 4 color-coded sections, as outlined in the next slide. And the resources provided in the toolkit are certainly not exhaustive, but provide easy access to relevant information that will help your after-school program take next steps in its substance misuse prevention and awareness efforts. Okay. Did we skip wait a minute, I'm confused. I thought we skipped a slide. Maybe not. Okay, here we are. No. Yeah, okay, I'm just confused. I'm sorry.
No, you're okay.
Okay, now I'm where I need to be. So the 4 sections that make up the toolkit are getting started, building resiliency, prevention education, and expanded wellness focus. Section getting started provides definitions of the term substance misuse, and substance use disorder to provide clarity in what can be somewhat confusing when talking about addiction. The section also provides resources for building awareness and preparing for an overdose emergency. The next section, which is resiliency and mental health, includes information on protective factors in after school and service learning. The third section, prevention education, provides information on student curriculum and communicating with caregivers. And the final section provides tips for expanding a focus on wellness within a program. The toolkit's designed for programs to review each section's ideas for action and choose 2 to 3 goals total to begin working towards increasing their prevention efforts. Okay, so this is a sample page from the Getting Started section. Each section is formatted similarly, and each page includes ideas for action, as I previously mentioned, as well as a pro tip and resources to explore. There are 3 pages in section Getting Started, and 2 in resiliency and mental health and prevention education, and then there's 1 for expanding wellness focus section, and links to the resources are embedded throughout the toolkit. So I think the toolkit's around 11 pages total, with like the cover page and some acknowledgements at the end.
Okay, so next steps. We want to share with you sort of, okay, how is this going to kind of roll out? And you've talked about examples of what this is going to look like and what it's going to contain, but how is this going to happen? And I will say too that, so ideally the rollout is happening November 8th. We wanted to go ahead and share with you guys though today about the toolkit and the, this new resource that we were going to be having. We knew that conference was a great opportunity to do that, but we also know with the groups that we're working with to put it together and everything that it wasn't going to have to be ready, but we did want to share this with you today. Loren, while I'm talking about this, do you happen to have that link handy that you could drop it in the chat box?
I just dropped it in the chat box. So
Great.
That link that I just dropped in is the link to register for that November 8th meeting.
Yeah, absolutely. So Loren has shared about that. We're going to be doing that joint meeting with Tennessee, and we really want some West Virginia representation. So we would love to have you join us. And there will be, in addition to sharing the official toolkit at that point, I think it would be really valuable for anybody who joins us that day to learn more about the effort, because you're going to get to hear a lot about Tennessee and all the work they've done in this area and how they've shared and really used their toolkits to make a lot of impact in Tennessee. While we're just getting started on this effort in West Virginia, they've got a long history there of different ways that they've done a variety of things in out of school time, from drug take back days to some trainings for providers and a variety of other things. So if you want to come, we would love to have you join us, and you can go ahead and register at the link that Loren just dropped in the chat there. We also want to encourage everybody to connect with your regional prevention lead organization. These leads and their organizations are so valuable. You can see on the map, find your county and figure out where you're connected with. Many of you may already be working with your prevention leads, or we did provide phone numbers there, and there's also the website. But if you have any additional questions about that, we would be happy to work with you to connect you with your prevention leads. They are doing a whole host of different types of supports that can be added into after school, or after school can be incorporated with. And these are just some very valuable groups that we wanted to share with you. And you see there, they are facilitated through the Help and Hope West Virginia, and also work closely with the DHHR Bureau for Behavioral Health as well. So we did want to make sure to highlight them today as we talked. Loren, is there anything else that you'd like to add about prevention leads?
I just wanted to say that I did drop the link in the chat as well for, I think it's the website with that map on it and the phone numbers, because you can't really see it on that slide. But I know that the prevention lead organizations are really looking to connect with folks in their region to do prevention efforts. And I think they do have an initiative going on where they're trying to do some leadership groups with older youth. So you might reach out to talk to them about that. But I would encourage you just to get connected, because they would be a really great resource for prevention.
Absolutely. I know we are working on some new prevention-based programming that Loren's going to talk about here in a minute. And they, even before we were able to get involved with the project, in some regions, they had already been working closely with after-school programs. So they're just a really tremendous resource.
Okay, so another step that you can take is joining an anti-drug coalition. You can locate a local coalition by visiting the Community Anti-Drug Coalitions of America website and clicking on the Join an Existing Coalition link. If there aren't any coalitions in your area, you can also find resources for starting a new coalition on that website. And then a second website you can visit is Get Smart About Drugs. When you get to that website, navigate to the Get Involved tab, and there's more information there about getting involved with the Anti-Drug Coalition. The Partnerships for Success PFS coordinators, which are housed within the regional prevention lead organizations that we discussed on the last slide, are also a great resource for joining or starting a coalition. And I'm going to drop the links to those two websites in the chat as well, in case any of you guys want to go there and check it out. Yeah, let me see if I can get to the chat. Here we go. So those are the two coalition websites where you can learn more about anti-drug coalitions in your area. Let's see. If you could go to the next slide, Susan. Okay. So the West Virginia Statewide Network currently has some free evidence-based prevention curriculum available through a partnership with the West Virginia Department of Health and Human Resources Bureau for Behavioral Health Partnership for Success Project, as Susan mentioned. These include BOP and life skills training and positive action. BOP and life skills training provides 40 to 45-minute lessons and can be taught weekly for a duration of 8 to 15 sessions as outlined in the slide. And then positive action provides 15 to 20-minute lessons, which should be taught 2 to 4 times per week. And positive action provides enough lessons to teach the curriculum throughout the entire school year. As you can see, for the grade level kits 4 through 6, there's 140 lessons there. So each curriculum has a supplemental drug education unit as well, which the network has available. And we have available curriculum starting with 4th grade and up through high school. So these are some really valuable research, evidence-based curriculum. And I would encourage you, if you are interested in implementing evidence-based curriculum, a prevention curriculum in your program, that you contact us, and we'll get you our contact information here on the next slide. But we have a limited amount available for each, so we want to make sure that we get that to you if you're interested. And we'll be working some with the prevention lead organizations as well. I know that they have some train the trainer sessions coming up for positive action. So if you've already been trained in positive action, or you're interested, you might be eligible for that train the trainer to make it more sustainable within your organization. But we'd really love to get that to you to support quality programming. So like I said, if you have any questions, just let me know. I've been coordinating most of that. And Susan, if you go to the next slide, our contact information is there.
Yeah, and I just want to say too,
Mhm.
Lauren has worked really hard to help implement this evidence-based curriculum, but it's easy to utilize. It's very friendly curriculum to take and to use. And the fact that it is evidence-based, if you're not familiar with evidence-based, that means it's rigorous, it's been researched, it's the highest quality of curriculum. And I'll also say, I mean, this is very expensive curriculum too. The fact that we can take this curriculum and offer it to after school providers for free is just astounding. And that is through some of the work the Afterschool Network has been doing to build some relationships and to partner more with the Bureau for Behavioral Health. So we are very thankful to them for the opportunity to share this curriculum. And it's really important that we get it distributed. And so we really encourage and hope that you will reach out to us, as Loren said, to request some of the different stuff. And if I know you're looking at this right now, but if you have additional, you're not quite sure, you have additional questions, again, feel free to reach out to Loren or myself. Loren is taking the lead on all that. She is absolutely the expert. But certainly just reach out to either one of us. We definitely want to get this material out. And we do have, like Loren said, some limited material, but we are actually going to be working in the next week. I already have some locations we're going to be taking that around to. So we would love to visit you and bring you some curriculum if you're interested. Loren, while I'm finishing up here for just a second, I don't have that link for the survey. If you wouldn't mind to have that ready and you can drop it.
Yeah, I'll have it ready. I'll pop it in. I'm going to try to pop the websites for those two curriculum in the chat as well. So folks can go check it out. I just need to confirm one of the web addresses real quick.
Yeah, no, take your time. Yeah. So here is, again, our contact information as our website. Also, we would love if you guys are on social media, connect with us through that way, either personally or with your after school program social media. We tend to share out there. We are also, we send monthly newsletters, general monthly newsletters, as well as a STEM monthly newsletter. So if you would like to be added to our newsletter list, just drop your email in the chat, or again, you can just email us and tell us that you'd like to be connected with that. On Facebook, you see our handle there, but it is written out on Facebook if you want to search for us that way. It's West Virginia Statewide Afterschool Network, and then on Twitter as well. So we would just love to have the opportunity to connect with you. Social media is really our way that we initially get out a lot of different trainings and information right off the bat. And as well as you've seen in the rolling slides, is that we have National Lights On After School Day coming up on the 28th. So we'll be sharing out some more information on that as well. So we would love to connect with you. See if I can get my chat to pop up there. And then while we are kind of finishing up, I am going to say the last link, I think it's the last link maybe that Loren is going to drop in the chat, is we are asking for you to complete a survey on today's session. It will just take you a minute. It's not very long, but we would love to get some feedback today from you about today's session. But I guess I would like to, and Loren might have a couple questions too, but I would love to hear about any of the perceptions of your needs around prevention supports that could be helpful for your programs related to the opioid crisis in our state, as well as any types of valuable resources that you know about, and also maybe any connections with your prevention leads. So that was kind of a whole lot of stuff I just asked about there, but if anybody, because this is not a Zoom webinar, it's just a Zoom meeting. So you'd be welcome to drop that in the chat, or if anybody wants to share, we would love to hear from you. Anybody? And then Loren, what am I kind of, what am I missing? What did I not share?
I think we covered most of it. Just again, we really encourage you guys to register for that November the 8th meeting, which the link should be further up in the chat. And do you see here some folks have been asked to add to the email list. So we'll work on getting you guys added to the email list. And then Carol said that they've used Positive Action a little and they love it. She said it is expensive, but it's a great opportunity. So she's plugging Positive Action. We've got it. You need it. Let me know. And we'll get it to you.
We actually have a lot of Positive Action right now, right? That we really want to give out. So
we have 5 pallets of Positive Action right now. So and like I said, we have grade level 4 and up. So the Positive Action comes in kits. So there's like a kit for 4th grade, a kit for 5th grade, and then all up through 6. And then there's a high school kit that would cover all of the high school grades. And in addition to that, there's an elementary drug education kit and a secondary drug education kit. So if you served elementary age kids, we could provide you curriculum for 4th and 5th. If you served, a combination elementary, middle, we could do 4th through 8th grade. We could really just provide you what you need. And each kit serves about 30 kids. If you have multiple sites, we can give you multiple kits. So we really just encourage you guys to reach out to us regarding that great resource.
Yeah, absolutely. And I think too that, we've been very fortunate to receive the opportunity to provide these programs, these resources and curriculums to after school programs. So we want to make sure that we're getting them out there, because it's hard to make the case again if we don't do that. And Loren did just do a whole series of different trainings on it. We have distributed a whole lot of them, but we do get some more that we can help distribute. I see Shannon ask a question about what do we need to do again for West Virginia Stars? Great question. So we will be getting the analytics from the conference, from looking through who participated and the hours and all of that. We did get your West Virginia Stars number whenever you signed up. The last thing that we need anyone who wants West Virginia Stars hours to do is to go back to the conference website. And there is a tab for the conference evaluation. We need everybody to fill that out. Please, please, please fill out the conference evaluation, but definitely if you need stars, fill that out. And then also just a reminder, I know that Loren just shared that in the chat. I'll go ahead and stick it in there again, but just for this particular session, also, we would love just a quick, very short session evaluation on this session. If anybody would also fill that out, that would be much appreciated. It's the nature of our work that we need to have this feedback. So we appreciate everybody taking their time to fill that out. Okay, guys, I think that's all that we have for today. Loren and I can hang around for a minute. We would love to connect with any of you if you have additional questions, or again, just feel free to reach out to us through email. And we really appreciate your time and are super excited that all of you joined us for the 2021 After School Conference in West Virginia. Have a great day.